Hi guys, good morning, good afternoon, good evening, wherever you are in the world. Dr. Dan Nightingale here, and today we're going to talk about something referred to as ameliorating transitional shock. Big words, but don't worry, I'm going to break it down for you. When we talk about ameliorating, we're referring to reducing something. So in this video, we're talking about reducing the risk of people developing transitional shock, which are negative impacts of sudden change, both psychological and physical impacts of rapid change, and that leads to the shock side of things. So ameliorating transitional shock relates to a rapid change in somebody's environment or somebody's situation without any planning or forethought. Now, as I start this, I want to make it clear that I am aware that on occasions this does happen where there is no opportunity to plan anything. There's a crisis and there has to be a crisis intervention, and so therefore I'm aware of that. But what I want us to really think about here is when we are planning a change for somebody who is living with dementia. So when we're actually planning a change, and if this is a change from moving from home to a nursing home, or to a residential home, or a memory care, or even to live with family, whatever we're doing, whatever change it is, it's a major change, and there's negative impacts of it if it's not done properly. So we want to think about the planning aspect of it. Now, I always talk about dementia being a journey where everybody's involved, and the main person is the person living with dementia. So imagine this as a story. This is a storybook, and the main character, the hero, is the person who is living with dementia. And all the supporting cast, all the other characters, are people that are there to help and guide that individual. So by saying that, we need to think about three parts of the process. One is pre-transition, the second is transition, and then the final is post-transition. So in the pre-transition phase, that central character, the hero of the story, is the one who is involved in decision making. Depending on where that person is in their journey will determine how much support, how much help, how much input they require to make those decisions, to make those choices. But what we don't do is disempower the person. We don't make those choices for them. We don't say, right, Bill, it's time for you to move into a care home now. What we do is involve that individual as much as we possibly can. The central character of that story is that individual. So pre-transition is really involving that person, talking about what they want to do, how they want to do it, what kind of things do we want to take with us to this new environment, because ideally we want to mirror the individual's home in this new environment, this new setting. So the way my bedroom is laid out now, I want to be able to mirror that in my new environment, because those things become anchors. Those things are things that I hold on to. Those things are my memories. Those things are things that make me happy. They make me smile, they make me warm, they make me feel comfortable, they make me feel at home. So that is the pre-transition. Everybody involved, but the person central to all decision making. And then we've got the transition. So when this transition takes place, I want you to make sure that this individual has the opportunity to express any concerns, any anxieties, any fears, because we all have them. When there's a major change in our life, when it's about to happen, we start to have some rumblings of anxiety, rumblings of concern. Maybe we have some questions that have never been answered, because we might be excited during the pre-transition phase really looking forward to it, really excited, and then the day comes for transition and there might be some nerves. So I want people to be able to express that. I want them to be able to say, look, this is how I feel. This is a little bit fearful for me today. There's some trepidation and I want to talk about it. They may not be able to verbalize it. You may notice this and observe this through body language. So it's for your part in this story to jump in there and say, are you okay? Is there anything you want to say? Is there anything you want to talk about? Is there anything we need to do? Anything we need to change? So make sure that happens. And then we've got post-transition. Now, during this whole process, what we've done is something called an Individual Transition Management Plan, an ITMP. And an ITMP is something that you can sit down and work with the individual and their family, and everybody work together before the transition takes place, so that we have a good understanding of that individual, we have a good understanding of what their needs are, what their wants are, what their dreams, their desires, their expectations. And we also want to have a baseline of their health, physical and psychological, because we're going to have a transition management plan, and it involves being able to monitor changes in that individual once they have made the transition. So at post-transition, there should be a checklist where this individual can be monitored for change, behavioural change, physical change, psychological change, mental health. You're looking at people's mental health and well-being, and ensuring that if there's anything changes immediately or within a very short space of time, then you can intervene, you can do something about it, and you can address the concern. And some of those issues, when it comes to the psychological aspect of it, can be signs of ill-being. We've spoken about signs of ill-being before, and we may see signs of ill-being as a psychological impact. And this might be crying, this might be sobbing, this might be withdrawing into self, this might be developing some fears and some anxieties that weren't really there before, or we didn't notice them before. So we can address them before it gets really out of hand, before it moves into a clinical depressive type situation. The physical side of things are where there may be incontinence, people might develop illness that wasn't there previously and has never been there before, some psychological trauma and things like that lead to physical symptomology. So we need to be able to monitor that so that we can deal with it straight away and manage it accordingly and appropriately. So we've really got to think about how that works. We've got to think about that whole process and ensuring that from start to finish, we have a really good individual transition management plan. And it's an individual transition management plan because everybody's different and everybody will react differently and everybody will respond differently. So ameliorating transitional shock, making sure that there is ample opportunity to plan, ample opportunity for the individual to get used to this change, whatever this change may be, and making sure that we're there to support that entire journey from start to finish. Now, I know you're going to have some questions. I could talk more about this, but I think it's important that you think about how you support the person during their transition, because, you know, I'm talking to the world here, so I don't know people and I don't know the families and I don't know the situations and the circumstances and people's strengths and people's needs and all those kind of things. But this all evolved many years ago when I was working at a hospital in the UK. There were two hospitals, very large hospitals, a few miles apart, where people with mental health issues and learning disabilities lived and had lived for many years. And the government at the time introduced something called the Community Care Act, and that was about closing hospitals and moving people out into the community. And many of these peoples had lived there for years, and some of them have been born there 80 years ago. So that's all they have known, this environment, this hospital setting where they feel safe, where they are able to walk and where they're able to do things safely. But these hospitals had to close. So it was decided that the largest of the two would close first and people would be relocated. And unfortunately, at that time, people didn't think about this. People didn't think that if Daniel and Lynn had for 20, 30, 40 years this friendship, because we lived on the same ward in the same place, we have this friendship, we know each other, but Lynn comes from Liverpool and I come from Manchester, then the funding at that time meant that if Lynn was going to live in a small group home, she would have to go to Liverpool and I would have to go to Manchester, because Manchester would be funding me and Liverpool would be funding Lynn. There was no consideration for that friendship, that relationship to continue. Both people were just moved. And that was it. That was it. No pre-transition or anything like that. It was just done. So I would never see Lynn again. Lynn would never see me again. And what we saw was that people who couldn't be relocated into the community, people who had severe challenges, behavioural, or some patients that were living in the hospital because of committing crimes and things like that, they had to be transitioned over to this smaller hospital. So the larger hospital, Brockhall, closed. The smaller hospital, Calderstones Hospital, is where we put people who couldn't be relocated, and wherever there was a bed, they were put. That was it. No planning. It was just shifted, just moved. And we saw so many problems, from people just dropping dead of a heart attack, people jumping out of top story windows. We had so many issues and so many challenges that I worked with the psychology department, and we looked at this issue and we created and developed a program and a process for making sure that this didn't happen ever again. So I'm going to wind this up now just by saying ameliorating transitional shock is all about reducing the anxieties and the fears of that individual when they're facing a major change. Any questions, please let me know. Drop comments in the YouTube channel, send email, contact me through Instagram or through my website, drdanielnightingale.com. Have a fantastic day and take care. And remember, dump the soda.